Hey, everybody. Welcome to the Social Media and Politics podcast, bringing you expert insights into how social media is changing the political game. I'm your host, Michael Becerra, Assistant Professor of Communication and Media at Lund University. You can follow the show on Twitter at SMNP Podcast or visit us on the web at socialmediaandpolitics.org. All right, y'all. Thanks so much for tuning in. In this episode, we're going to be talking about people's everyday online experiences using private social media apps like WhatsApp and Facebook Messenger. And in particular, we'll be discussing how they are confronted with COVID vaccine misinformation and whether or not they decide to confront that misinformation themselves. And my guest to discuss this is Professor Andrew Chadwick. He's a professor of political communication at Loughborough University and director for the Online Civic Culture Center there. And he's been working on a project called the Everyday Misinformation Project, which is funded by the Leverhulme Trust. And we'll be discussing in this episode the first report from that project. It's co-authored with Professor Christian Vicari and Dr. Natalie Ann Hall, and it's entitled COVID Vaccine and Online Personal Messaging: The Challenge of Challenging Everyday Misinformation. And what's interesting about this report is twofold. One is that it focuses on private social media apps, which we don't have so much research on. They're difficult to study because they're end-to-end encrypted. But one of the ways to get around that lack of trace data is what I think is the second interesting part of this report, is that it's truly qualitative. So Professor Chadwick and his team have spoken with 102 British adults spanning from London, the East Midlands, and the Northeast. So a nice geographical spread there, and we'll talk about the sampling a bit more in the episode. But what these interviews really afford is data that's rich in context and allows for a really deep dive into people's everyday practices of using these platforms that we don't know so much about. And in particular, their thought processes behind engaging with vaccine misinformation, which is flowing through these platforms in ways that the tech companies themselves can't see. So in the episode, we're going to talk about the norms that arise in these different apps. And I think that's really interesting because if we think about how we use WhatsApp or Facebook Messenger, we have our one-to-one direct connections with very close ties, right? Like friends and family members. But then we often get lumped into these larger groups, whether that's for everyone who lives in an apartment building or the parents' WhatsApp group for all the kids that go to the same school. And these are different communication environments, right? Some more private and some more public. So this encourages what Professor Chadwick calls hybrid public interpersonal communication. And if you're familiar with Professor Chadwick's work, you'll recognize that hybrid. But as he says in the episode, there wasn't quite a term that captured it. So we'll discuss about what this hybrid public interpersonal communication is. And in particular, we'll talk about the norm of conflict avoidance, which plays a key role in people's decisions on whether or not to challenge misinformation in these private messaging apps. So all in all, a really interesting episode. I'll put a link to the report down in the episode description. And it's important to remember that this is the first tranche of the Everyday Misinformation Project. So I think we'll hear more about this hybrid public interpersonal communication concept. And just remember, you heard it here first. But without further ado, let me turn it over to Professor Andrew Chadwick. Again, he is a professor of political communication at Loughborough University. Professor Chadwick, thanks for taking the time out and welcome to the Social Media and Politics podcast.
Thanks so much, Michael. It's a real pleasure to be here. And, thanks for all your great service with this podcast, which I've been listening to for quite some time now, since the early days.
Wow. Cool to hear. Well, to start out here, the report we'll be discussing today is part of the Everyday Misinformation Project, which seeks to understand why people share and correct misinformation online. But here you're taking a specific focus on personal messaging apps, where encryption limits automated interventions like taking down misinformation, like we see with some of the major public social media companies. So could you introduce the Everyday Misinformation Project, as well as how you and your team have been going about studying these encrypted services?
Sure. Just to give you a bit of background, this is a project that we put together, I and my colleague Christian Vicari, who's at Loughborough with me. We put this together quite some time ago. It was actually in 2019. We submitted it for funding, and due to the deadlines, you have to wait several months. We got the funding actually in March 2020. And we were scheduled to begin the project in the September of 2020. But due to the pandemic, we had to redesign the fieldwork. And that's relevant actually because the first part of this project is a 3-year project, and it's essentially got 3 strands of data collection. The first part of it was always designed as longitudinal, in-depth qualitative interviews, which we designed in order to learn more in interpretive terms and using qualitative methods about how people in their ordinary everyday lives go about handling their interactions with people who share misinformation. We deliberately chose the personal messaging apps, what these platforms are also known as private social media. We chose that focus because in the UK, many other countries as well, by the way, but certainly in the UK now, these kinds of services are incredibly popular. WhatsApp, for instance, something like approaching 2/3 of the adult population regularly uses WhatsApp in the UK. And they are more popular even than the big, heavyweight public social media platforms. Of course, the most important one in the UK being Facebook still, but Instagram not far behind. And then we've got other apps such as Snapchat, for instance, and of course Twitter, but Twitter only includes about 20% of the British public. So with this project, we wanted to take a deep dive into this largely hidden world, I have to say, of personal messaging apps. As you said in your introduction, they're incredibly difficult to research, and arguably they've been quite seriously neglected in the research literature, not just in political communication, but more importantly, the literature on misinformation that's really gathered steam since 2016, of course. So what we wanted to do was, because we could get funding for this, the Leverhulme Trust were so kind and generous to back the project, we've got the opportunity to have a really fully fledged mixed methods approach where we've got 102 members of the British public. We aimed for 100, but we managed to overshoot that target, who we're tracking essentially with longitudinal design of in-depth interviews. So an interview at time 1, an interview at time 2, which are semi-structured, and we get to talk to people in a great deal of detail about how they handle misinformation, what they think about it, how they gather trusted sources, what kinds of news they access, and so on. And then the second part of it is what these participants have done in the gap between the first interview and the second interview, where they've uploaded personal messaging content that they've encountered, largely on their mobile devices. They've uploaded it via a mobile ethnography smartphone app that we asked them to install on their mobile devices. And they've sent us information of various kinds, some of which is useful and they find it useful. And the other category is what they consider to be misinformation. So that's a piece of data analysis that is still outstanding. It doesn't feature in this report. The third aspect of this project is what will commence in the autumn of this year, which is multi-wave, nationally representative panel surveys, which will be using the findings from the first 2 strands to design. So the aim is to try to design survey instruments and some survey experiments based upon an in-depth qualitative understanding that we've developed from the first phase of the project. So only when you've got a 3-year project where you've got a data collection budget, and we've got a really terrific research assistant on the project called Dr. Natalie Ann Hall, who joined us from the University of Manchester. She's a sociologist by background and did her PhD on understandings of Brexit and misinformation on Facebook. So when you've got the luxury of putting together a project like this, you can come at the problem of online misinformation in a variety of different ways. And the advantage finally is that we're hoping to be able to say a lot in a short period of time, 3 years, about something that's been neglected in the research literature so far, as I say, which is the personal messaging apps, particularly WhatsApp.
Absolutely. I want to pick up on a couple things you said there. One is about the popularity of these personal messaging services relative to the academic literature. And so, like, WhatsApp is definitely in focus, but also Facebook Messenger, which just a quick anecdote from a study that I did on a student sample in Sweden, university students at Lund, they almost all said they didn't use Facebook. But then when we surveyed about what platforms they were using, almost all of them did use Facebook Messenger.
Yes.
So there is this kind of gap, right? And then the other thing I wanted to bring up was, like, I think it's really nice, this design you have. I mean, we're going to be talking about the interviews today, but if I understood you right, there's also this data donations approach, which we talked about with Dr. Jakob Oma recently. So I love this idea of data donations, and then of course the survey. So getting this triangulation, I think, is going to be really nice.
Yes, I mean, on the first point, we found a lot of people who, they did make distinctions between the public world of Facebook and the private world of Facebook Messenger. And of course, Facebook Messenger is end-to-end encrypted, certainly in the European Union. And it is a distinct service. It is different from, the public version of Facebook. But one of the things that we've examined in the project, and it's not so much the case that's in this report, but we have asked people about how they distinguish between these different types of environments and the norms that they develop for communicating with other people. And we've got some interesting findings about this actually in a work in progress paper. But yes, we did certainly find that Facebook Messenger and WhatsApp were the two most popular. And we found that people did distinguish between public and private, but in some interesting ways that I hope I'm going to get the chance to talk about. I mean, the other question here is really about, how can we as researchers get into how people make sense of these spaces in their everyday lives? One of the things that is lacking, I think, in the misinformation research more generally is an understanding of how misinformation sort of flows around and gets into the texture of people's everyday lives. And the thing about these apps is that they do have a kind of intimate place often in people's lives. We use them to communicate with our friends and family. And at the same time, however, when one belongs to a larger group, such as, some of the school groups that we found that are very popular in the UK, school and neighborhood WhatsApp groups are very common now. They'll consist of parents of, children who are in the same class in the same year in school. And they are seen, however, as slightly different kinds of environments from the interactions that take place among very close friends and family. Those kinds of environments in the groups of 20 or 30 people, sometimes a bit larger, sometimes a bit smaller, are seen by people as what we call hybrid public interpersonal communication environments. So by using that term, which is a bit awkward, I appreciate, but we couldn't quite find a concept that really encapsulated how people switch from the public or semi-public environments that they see in the larger groups. And of course, in some countries, these groups are much bigger because political campaigns, for instance, in countries like India or Brazil, they will use WhatsApp much more frequently for that purpose than occurs in the UK at this point in time. But usually in this project, what we found is that the people who we've interviewed have involved themselves in these bigger groups where it's school, it's neighborhood, or it's work colleagues. And they see those kinds of environments as slightly different. And it poses a problem for them, as I hope we'll talk about soon, when it comes to challenging misinformation, because their understandings of what is public, what is semi-public, and what is private, people are constantly trying to negotiate those distinctions. And it often leads to some difficult situations where, as we argue in the report, misinformation around COVID vaccines is likely to just carry on flowing around because people don't feel empowered to challenge it because of the nature of the environment.
Yeah. And I mean, I think definitely reading the report, you get the sense that this qualitative data really does kind of give you this window into how people are experiencing and engaging with these private messaging apps in a different way. And I know the temptation is to get there, at least for me, but I'd like to start with some of the theoretical arguments you make, which are about, making a distinction between these personal messaging apps and the more public social media services around the ideas of interpersonal influence and social norms, which you hinted on a bit. But I think it's interesting because generally scholars talk about the norms of platforms. They're kind of talking broadly about what's generally acceptable to say on Twitter, for example, might not have the same norms as Instagram. But I think you're looking at it in a bit of a different way. So I wonder if you could elaborate on the importance of norms within these personal messaging groups relative to the more broad understanding of kind of platform norms that we generally talk about.
Yes, absolutely. I mean, we've done some research. I did some research with Johannes Kaiser and Christine Bakari looking at this issue of comparative norms, and we found some pretty interesting findings around people being much more likely to share misinformation on Instagram, for instance, than other platforms in the UK, which is a piece that's coming out soon in American Behavioral Scientists. So I'm very aware of that debate, and I think it's really important. But you're absolutely right. What we wanted to do with this project is not start necessarily from the affordances of a platform and start speculating about those, but actually try to embed people in their social relationships that actually transcend the platform. Now, I'll just explain what I mean by that. The fact of the matter is that a lot of people use WhatsApp and Facebook Messenger to stay in touch with people who they trust, who they know quite well, who are friends or family. They do have these other groups, the more public or semi-public groups, the work, the school and neighborhood groups. Some of them, our interviewees, also belong to international diasporic groups. So they were connecting with their family and friends in other countries, parts of Asia, for instance. But I think what we wanted to do was start from this idea that the relationality that we talk about quite a lot in the report, where you've got to understand how interactions lead to social norms that develop not necessarily always spontaneously, but they actually develop out of the interactions that people have in these environments, that they are going to be shaped by, in a sense, old-fashioned social forces, such as, the kinds of people who tend to get on with each other, who forge friendships, who've got things in common, such as people who are in the same working environment or the same neighborhood. So we wanted to not kind of read off the social, as it were, from the nature of the platform. At the same time, we wanted to be aware of how people are actually using these apps and these platforms. And as I say, there is a little bit of research that's built up over the last 3 or 4 years, really, that shows that, these are the typical patterns, that it's trusted ties, it's small scale social networks of people who largely know each other. When it comes to the issue of misinformation in particular, we were particularly concerned with how that travels across these networks in ways that, it's not always governable by the nature of the networks and the environments that people inhabit. So, one of the challenges of this kind of environment is because of the forwarding facility that you've got with WhatsApp, that's proved to be very controversial over the last 3 or 4 years. And of course, Meta have made some changes to it to try and discourage this kind of behavior. But if you use WhatsApp, you'll realize that sometimes, a friend or a family member will forward something and it will appear in the group. You've no idea where it's come from. It's just been forwarded. The provenance of that is very, very murky, difficult to determine. And this in itself is an aspect of these environments. So when it comes to norms, we've got quite a discussion in the report of what our understanding of norms is all about. It's a kind of combination of what the platform and its affordances encourage, but it's also about the social relationships that, in the social sciences, the literature on social norms is decades old. It's rooted in social psychology, it's rooted in sociology. There's a bit of it in political science and, of course, communication as well. And we wanted to get that kind of sense of how norms are constructed in people's everyday interactions in ways that then go on to shape subsequent interactions. So it's a kind of constructivist or social constructivist relational framework. We're trying to get away from deterministic understandings of the impact of platforms on people's behavior, but equally we recognize that those platforms and the way they operate do shape, in some circumstances, what people do on the platforms. And when it comes to misinformation, as I say, the lack of provenance and the fact that you've got people introducing information from a wide range of different sources, whether it's mainstream news, whether it's alternative news sources, whether it's just memes that a family member came across and decided to put into the family WhatsApp group. All of that needs to be put into the mix to understand how these norms develop.
Just hearing you talk, I have some thoughts that I think do bring in a bit of the these kind of platform features, right, that I'm very interested in. And if I could bring in a bit of an industry argument that I always find quite interesting, and that is about creating the norms and fostering those norms from a design perspective. So one of the quotes that stuck with me was I heard a podcast with the CEO from Flickr, and she was talking about how when she was starting the platform, they had to make content moderation calls about what would be allowed, particularly in terms of, I think it was about women in bikinis, because they had a lot of Muslim users on the platform. And basically, the argument is that in the beginning of a social media platform, you really have to put in the work in terms of setting the boundaries of what is acceptable and what's not acceptable. But what's interesting with WhatsApp is that it's much more decentralized, right? You have these groups that kind of form on their own, and then the norms are created within the groups kind of autonomously. And so I think that's really interesting because there it really matters how these norms kind of organically arise, both at the level of a specific group and then, multiple groups, and then at the platform level, all these different groups. So that's a long way of saying, I think that the fact that the groups aren't necessarily moderated from the top down, but kind of from the users themselves, makes the development of those norms all the more interesting and all the more important for how misinformation spreads within those groups.
Yeah, that's a great point. That really is where we're coming at this from, because these are very simple services. I mean, even the more complicated ones, we have interviewed people who spend more time on Snapchat, a small proportion, which is a bit more complicated, but still there is a sort of core of simplicity at the heart of these services that people are attracted to. They are analogous to old-fashioned SMS text messaging, but in a sense, they're also quite a radical departure from those old services because of the group formation. We've got people who opened up a lot to us about the different ways in which they try and police group norms when they set up new groups or decide what the theme of a group's going to be, or set up kind of informal rules. We've got, again, another paper in progress where we're looking at group formation, which is, that's probably the biggest example of norms playing a role where they are, as you say, decentralized, because this is literally people who are, deciding among themselves collectively, albeit in small groups, about what kind of content is going to be valid for sharing. Equally, we recognize that the features of the platform also play a role, because we've got lots of people in the project have talked about how they do things like mute notifications, or they scroll past pieces of information very, very quickly so they don't have to read it, or sometimes they just ignore information. We've got some great examples in this report of there was a woman who lived in London who was telling us about how she knows that her relatives, her nephews and nieces, actually in a family group, were posting frequently misinformation about COVID vaccines. And one of the ways that she sort of learned to deal with it, while not provoking any conflict with them, was to scroll past the misinformation very, very quickly, so it showed that she'd read it. Because, of course, the thing about WhatsApp is that when somebody's read your message, and you can also see when people are typing in response. So these little kind of features, people are very aware of them, and they negotiate these in their everyday lives. So rather than challenging overtly in the group what this lady wanted to do, she didn't want to do that, because she was definitely into the idea of conflict avoidance, as we discuss in the report. But it wasn't enough for her just to ignore the posts. It was kind of the act of kind of scrolling past them quickly, so that in her words, she said, oh, well, then the information just goes over. What she meant was it kind of goes over the page, or it goes down the page on her phone. So people are very aware of how the platform's designs can make a difference, and they factor that into the way that they handle misinformation on the platform. So as usual, it's not a question of either or. It's, not only but also. And I think that with this one, what we found is that, yes, the platforms are very, very simple. The apps on the mobile devices, there's a kind of brutal simplicity about them. There is no formal role for content moderation, although interestingly, of course, outside of the GDPR and indeed inside the GDPR, it is possible for Meta to see posts, because you can report to Meta WhatsApp posts that you consider to be spam. And Meta does have a small outfit based in the US that does review these spam messages. But the reality is, of course, that it's absolutely tiny proportion of all of the content that's on WhatsApp globally every day. And it's absolutely nowhere near the size of the ongoing content moderation, often at scale, that occurs on Facebook, the public platform, Twitter, the public platform, Instagram, and so on. So the reality, as you say, is there isn't much scope for, at the design phase, whenever that was, when WhatsApp first started out, it wasn't owned by Facebook, of course, who took it over. And yet you just don't have that ability to sit down with a set of design principles that, you can have a public debate about and implement on a daily basis. And I think that's what makes it all the more important to adopt the kinds of methods that we're doing with this project, which are qualitative, small scale, and interpretive, trying to learn about people's social interactions on an everyday basis.
Absolutely. There's tons of stuff I want to pick up on, but I also do want to get to the findings of the report as well. But before we get there, I do want to ask you a bit about the sample. Just to clarify for our listeners, kind of who you talk to and how do you go about approaching, maybe some of the listeners plan to have some interviews, maybe for a master's thesis or whatever. I mean, how do you go into talking to someone about something so controversial? I mean, do you dive bomb right in and say, hey, what's your misinformation landscape like? Or,
Well, I'll come on to that, but in terms of the sampling, so what we wanted to avoid with this, and again, it comes back to the luxury of having the funding in place. We wanted to avoid snowball sampling. We wanted to avoid word of mouth. We wanted to avoid convenient samples. So we teamed up with an opinion polling company that are really big in the UK called Opinion Research. The Online Civic Culture Centre that I'm the director of at Loughborough, when we first set it up, Opinion got in touch actually and said, we'd like to work with you. Is there anything that we can do? And so we said, yay, brilliant, absolutely. And they let us run some surveys free of charge, and we've published a number of papers off the back of that. But with this one, we had the funding in place. And so what we asked them to do was to recruit participants on a fairly tightly defined set of criteria. Now, because it's 100 participants, and because it's 3 regions of the UK, we wanted the regional element in the design because we wanted to explore these neighbourhood effects. So we wanted a sense of people being at least geographically bounded in some way so that we could introduce that in the interviews and connect the experiences of people in these 3 different regions. So the northeast of England, which is where I was born and grew up, the East Midlands, which is where Loughborough University is situated, and then London. For obvious reasons, it's the south, it's the major city in the country. But then beyond that, what we wanted to achieve was a rough, and I say rough because, of course, this is 100 people, but we wanted a rough approximation of the demographic composition of the UK based on some key variables: gender, age, ethnicity, educational attainment, and a basic measure of digital literacy that we took from a national survey run by Ofcom, the Office of Communication, which is a media regulator in the UK, where they asked people some basic questions about digital literacy. We wanted that in there because we wanted to try to mirror in our participants what the distribution is nationally on that question, which is a really cool question about how people appraise search engine results, whether or not you trust them implicitly, whether or not you think that Google only selects the great results which are trustworthy, or whether or not you don't care. So when we got Opinium involved, we said, look, we want you to recruit on this basis. And we had an iterative approach. So we started approaching people and we recruited them. We started doing interviews. And then as we went along, to make sure that we could calibrate the overall sample of the 102 people, we could weight specific categories for recruitment. So, I think in the early days, we didn't have many people from the Northeast. So we said to Opinium, we want you to oversample on people from the Northeast. And then, we could oversample on men at the right time. We could make sure we had a good distribution of the different ethnic minority communities in the sample. So it's by no means, quantitatively representative of the UK, but we're confident that we've got a wide variety of people from lots of different backgrounds. So we feel a bit more confident. We don't want to generalize because we can't. And of course, we've got a huge section in the report at the end where we talk about the limitations and, the fact that you can't generalize to the population level. But equally, we don't have the same level of limitations, I would argue, as often happens with some qualitative work where it's very, very difficult to determine, what kinds of people actually participated in the study. So that's the first aspect of it. Now, when it comes to misinformation and asking people, again, that's a great question. We did some pilot interviews before we got started because we were concerned that this would be, a kind of off-putting thing for people who, they don't. I think that the issue here, that what's really interesting is that none of us likes to be judged. We don't feel like it's a comfortable thing to be asked questions about misinformation, because if you're not careful and you don't do it in the right way, you can put people off because it feels like you're judging them and you're kind of saying, well, you're a problem. So one of the strategies we used that worked out really, really well, actually, given the philosophical underpinnings of what we're trying to do, is we invited people to open up about what they see in their everyday interactions. So rather than saying to somebody, do you share misinformation, which was the absolutely disastrous question to ask, we moved gently toward trying to encourage people, and by and large it worked, to tell us about what they saw in their interaction. So it was a question of, a lot of the time it was people talking about other people and what they were doing. And it's surprising how you can get people to really open up honestly about what they encounter when you don't point the finger at them, but you ask them about their experiences. And I think that's how we got around it. And it was fascinating, actually, to listen to how people would talk about their experiences. Of course, we guaranteed full anonymity. Any information that we use from these participants is fully anonymized. All of the names in the report are pseudonyms that we've invented. And where it was impossible to disguise characteristics, we've switched things around, like some of the, we've got a key file where some of the genders have been switched so that we don't give the game away. And all of the geographical regions, however, in the report, they are all as were told to us. But some of the other characteristics and specific details of people's experiences, we've changed to guarantee their anonymity, which is, of course, good practice in all research, not just qualitative research like this.
Definitely. And I want to return back to the idea of qualitative interviews. It seems like there's more and more, need for those in these types of studies. And I think this is a report provides a really good example of how to, as you said, of course, it's not going to be nationally representative perfectly, but I think it's a good standard to follow and to try to get a representative group to the best you can with interviews. So you had so many of these conversations. And I think, as you outline in the report, a key finding that emerges from these conversations is this prevailing norm of conflict avoidance, which seems to be quite specific to these personal messaging apps. But it's not just that people avoid conflict because they're messaging with their friends or family or coworkers. There's also what you call this hybrid public interpersonal dimension, which you hinted to earlier, where people opt out of challenging misinformation to not transgress the norms of the group. So could you unpack what you found there in terms of conflict avoidance and this public interpersonal dimension of it?
Yes, absolutely. At the heart of this, I mean, there's several aspects to it, but at the heart of it is this notion that when you have an environment where people often, and remember that lots of people have simultaneous chats on the go, so they'll be chatting with two or three friends or just one other person, and then they'll be in a group with say 30 people. So there's that kind of temporal switching that happens anyway. But the reality is that a lot of people do distinguish between the more public groups, which generally tend to be larger, and the smaller groups where they tend to have higher levels of trust with known others. So the problem with this, however, is for the norm of conflict avoidance and how that shapes whether or not people challenge misinformation. And in the report, we largely argue that it prevents people from challenging misinformation. The problem is that in the small groups where they're more private, they tend to be interactions between people who are fairly like-minded anyway, because they're close friends. And if they're family, then they kind of, they've grown up in the same environment, they know each other. That's not to say that there isn't conflict among families, and I'll come to that shortly. But the small groups don't really lead to a great deal of challenging of misinformation because people tend to be like-minded. So we've got some of our participants told us about how, they will go from the larger groups, like a school group, into a smaller group to kind of sort of get a bit of social solidarity, if you will, from people who they know well, and to take a break from what they're seeing in the larger public groups and to kind of check things out. So, we have these two concepts that we really invented for this aspect of the study. One is what we call scaling, and this is where people go from the larger group to the smaller group to try and get information or checking things out. Am I right? Is this really true? The idea is that they kind of recover from some of the problems that they get in the larger groups by going down to the smaller level. But also people do it in the opposite direction as well. So, we've got an example of one man who told us about how in the larger group, they have to be careful because they know, and this is a group of old university friends, somebody who's sort of middle-aged participant based in London, had a group of university friends and they were all in the WhatsApp group, and they knew that some of them were vaccine hesitant. And so they went down into the smaller groups to kind of say to each other, well, how are we going to handle this in the bigger group? So they take that knowledge back into the bigger group to handle it in a way that avoids conflict. So they didn't want to call out the misinformation in the big group, which is really important. So it doesn't solve that problem, but it sort of makes it easier to avoid conflict. So it maintains sort of healthy social relationships, but it doesn't, unfortunately, lead to any challenge of misinformation in the group. So that scaling is really important. And then another one is what we call gauging, which is related, where people will just simply do some asking around in other groups to find out what the facts are about vaccines, to try and equip themselves with information just for their own purposes, really, not necessarily to take back to other groups and start challenging people, but just to sort of say to them, be confident in their own minds about their personal decision about vaccines. And one of the recommendations we make in the report is actually people should be empowered to go a little step further and use the information that they get in these moments of gauging and scaling in a way that it makes it easier for them to challenge misinformation in the groups and get beyond the norm of conflict avoidance. Because the problem with conflict avoidance is that it does cast a long shadow over these environments. Some people find it really difficult, even though they might be very convinced and very certain of the importance and the science of vaccines, but they feel often very, very constrained in challenging others, whether they be family members because they don't want to provoke arguments in these more close-knit groups, or, and I think this is the biggest challenge, in the bigger groups where people have some rather kind of old-fashioned, in a way, concerns about, standing out from the crowd or being seen to provoke conflict. Or one participant who's mentioned in this report told us that she knew exactly what the problem was, but she was concerned that if she started to challenge the vaccine misinformation, that it would then lead to a kind of escalation where people would start asking her for more facts and more of the science that she then felt she didn't necessarily feel comfortable with, not because she had problems with getting vaccinated. She was clearly pro-vaccines and had been vaccinated, but she didn't have the confidence to sort of take it a stage further where she thought, well, I'm going to be asked to share links and I'm not really sure where they're going to come from. And I'm a bit worried that I might embarrass myself and that people might think that I'm being arrogant or unnecessarily provoking division in the group. So those are all themes that we've seen in the literature about avoiding politics and avoiding conflict in politics that actually goes back, several decades now. A lot of it actually in some of the earlier political communication research from the 80s to the early 2000s has these kinds of themes in it, but obviously in a radically different context from personal messaging. But those are the kinds of things that we point out in the report when it comes to conflict avoidance. And it was a big finding in this aspect of the study, definitely when it comes to vaccines. And it is a challenge, I think. And I think it's not something that's easily dealt with within the confines of the traditional or mainstream of misinformation research that we've seen over the last 6 or 7 years.
Yeah. And I mean, I'm just thinking, this idea of scaling. So I think just to kind of summarize, you have people who are hesitant to challenge vaccine misinformation in these kind of more semi-public WhatsApp groups, for example, with coworkers or with parents of other school children. But what they do is they scale down into like-minded groups where they're maybe have more closer ties and saying, hey, what do you think about this? So this kind of, wouldn't this be great to have in real life? If you're at a party and someone says something and you say, hold on, let me stop time, go into my, my trusted group, ask how to deal with this and come back. But people are doing this on WhatsApp in real time, right? They're floating in between these groups.
Yeah.
I think it's super interesting. And I wonder how you think of course, the key takeaway there is that the vaccine misinformation is being challenged among people who already share the same opinions in these scaled down groups.
Yeah.
What do you think this means if you start adding up all of these small examples of the different groups that you've been looking at and you kind of scale it up to the UK, up to the world, because this is a global pandemic? What do you think these instances of conflict avoidance and kind of letting this misinformation go unchallenged means in these kind of more personal messaging apps?
Yeah, look, I think that's really, really interesting. And one of the advantages of this style of research is that it can unlock some of these interpretive themes that just are so difficult to generate completely from scratch if you were designing a survey. One of the things that we found, we've done quite a lot of survey-based work and survey experiment work based on, trying to understand why people share misinformation. But one of the challenges that we've always faced is we kind of sat there sort of designing a survey thinking, yeah, this feels right. And, we've got a research literature that can inspire us and we've got some of our own ideas as well. But we've always felt that unless you're talking to people and finding out how they're behaving, their social practices in everyday life, you're really just kind of you're basing it on an imperfectly contextualized, imperfectly grounded set of ideas. So the good thing about this is that we can take these ideas and think about how they might scale up to the level of the platform itself, to the level of societies. What we conclude in the report, and I hasten to add, of course, is that we don't have any data that can directly show this, but we extrapolate from this that one of the reasons why these platforms contribute to the spread of misinformation is because of these social norms of conflict avoidance. And so it's not necessarily anything directly to do with the nature of encryption, for instance. A lot of people have said, oh, the problem with WhatsApp is that it's all encrypted, it's all private, so people can say what they like and that's a problem. Well, yeah, of course that is the reality, but just as important is the fact that misinformation is likely in some cases to go unchallenged because of a social norm that is about people's social relationships. It's not really to do with the encryption of the platform. Even if these interactions weren't encrypted, I think you would still have given the nature of how WhatsApp works, for instance, and Facebook Messenger works, you would still have this problem. So I think that what we hypothesize really is that this is one of the explanations as to why vaccine misinformation spreads, is because there are reasons that prevent people, they disempower people, if you will, from challenging it in environments where they could. So I think that looking at how this scales up, I think that it's a feature of this kind of platform, and it's unfortunate, but it means that we need to start with the individuals and their experiences when it comes to designing anti-misinformation interventions. And that's something that we talk about a little bit in the report. We don't have much detail on it, but we're interested in what we call person-centered interventions rather than content-centered interventions.
Yeah, I think it's a really important point. It's that, yeah, you're right. People tend to just say, they default to, oh, well, these platforms are encrypted, so we don't know what's happening. But of course, all social media is social. So the social norms are crucial for what's happening in those encrypted environments. So let's piggyback on what you were saying about personal interventions, because maybe part of the solution is not just uncrypting the platform or dealing with content takedowns, but also dealing with the people and the more social norms approach. So what broad strategies would you recommend in order to limit some of this misinformation sharing about vaccines?
Yeah. Now, at this stage, I have to say this is all pretty speculative, because it's one of the major outcomes of the project when we come to its end is we'd like to devise something in more detail than we've managed to float in this report. So what we've got in the report is a few basic principles, starting from the person rather than the nature of the content or the posts themselves, although we realize that, of course, these things are intimately connected. But what we're interested in is a kind of capacities-based approach. So where people are empowered to recognize when they can intervene, to call out misinformation, to do that not in an antagonistic way, but in a way that recognizes the importance of empathy, a dialogue-based orientation. In the literature on vaccine hesitancy, which goes back several decades now, the social science of this is quite well developed, and it was well developed before the coronavirus pandemic. There is quite a big tradition of qualitative, community-based, dialogue-based research that talks about the importance of not, calling people out and being sort of arrogant and saying, you don't have the facts, you don't know what you're talking about, but instead listening to people's concerns, engaging them in conversations, trying to understand the roots and the origins of their hesitancy toward vaccines and the science. And there's a really important lesson here, I think, for health communication, which draws on this idea that the overt anti-vax, I'm reluctant to use that term because, one, I think it's a term that labels lots and lots of different opinions under one umbrella, which I'd rather avoid, but it's in popular discourse, so let's go with it. The second reason why is I think it can perversely, it can glamorize, especially the use of the two X's, in the anti-vaxxer. It can kind of lend an air of kind of rebelliousness and glamour to the whole position. But this kind of work I don't think what we're recommending is going to make a lot of difference directly to the overt anti-vaccination segments of opinion around the world and in the UK. They're only a very small minority anyway, but I think it's more important to address the segments of the population that are ambivalent, that are undecided, that have a range of concerns that they haven't been spoken to about, and it's those people, it's those who are worried about things that they shouldn't be worried about, but haven't had the opportunity to engage on. I think that's the kind of universe we're talking about here. So it's really about empowering people in their everyday lives to be able to speak up in a way that doesn't antagonize people, but is empathetic, dialogue-based, and is based in the reality that people need to maintain healthy relationships with friends, family members, the other communities that they belong to, So it's not a question of switching off the norm of conflict avoidance entirely and saying, you should start provoking conflict. It's not about that. It's about instead just making people aware of the ways in which these communication environments work. It does impose some limitations that people have to be cognizant of, especially health communicators, if they want to encourage people to go online and challenge vaccine misinformation. And I think people should be encouraged to do that because, the science of vaccines, the science of COVID vaccines now, despite all of the toing and froing of the last 2 years, is clearly and absolutely well established. So the other thing that we think people should be aware of, especially health communicators, is the scaling that we describe in the report. So we should provide opportunities for people, or we should encourage people to work together in some of the small group interactions and take the knowledge that they're sharing and the social solidarity that they're gaining in those smaller interactions where the people trust each other, and perhaps work together in the larger groups so that it's not just an individual who stands out and sort of puts their hand up and says, no, I think that that's wrong and I'm going to call you out on it. It's easier to do if you've got a collective approach where, if you're in a school group, we see people do this all the time, right? So in school groups, there are alliances of groups of parents, people who know each other better, people who share the same views, and they will naturally and organically kind of come together and cluster around particular issues in school WhatsApp chats. And we see that with neighborhoods as well. So that kind of collective approach, which would involve avoiding asking individuals to stand up and say, no, I'm going to challenge this. If you can get people to work together in small groups so they can take the solidarity and the knowledge that they've acquired and that they've constructed and shared in the smaller groups, take that to the larger group, it will make it easier to challenge the misinformation in the larger groups. I do have to say that I think that the larger WhatsApp groups are in many ways the biggest problem here. And when I say large, I'm not talking about, a public social media experience. I'm talking about that anything from kind of 15 to 20 upwards, where you've got lots of people who are sharing information from lots of different sources. And the exposure levels, if people are paying attention to those groups, and of course, people aren't always, and we've got to be aware of the fact that one means of avoiding misinformation is simply, as I described earlier, not exposing yourself to it by just not caring and sort of, thinking that you can scroll past it and all the rest of it, mute the notifications. But one of the things about the larger groups is that the reality is if you're in a group of 30 or 40 school parents and one parent posts into that group, you can pretty much assume that a majority of the people in the group are going to see it, unless they've turned off, the group and they're not paying attention to it. Because of the nature of WhatsApp, it's always on, it's there. People check it dozens and dozens of times a day. We've got people who told us they check their WhatsApp over 100 times a day. And the exposure levels are potentially higher. So if you've got somebody who shares one piece of misinformation over a weekly period, they share something every day, and there's 40 members of that group, that, induces the fluency effect through repetition. Constant exposure means that people, as we know from social psychology studies of information exposure, that the more that you see a piece of misinformation repeated, the more likely it is that you'll accept it just because you become more comfortable with it, even if it's false. So I think that it is those kinds of environments that are the biggest problem when it comes to the spread of misinformation. One thing I will say finally, though, is that we did come across people who will overtly challenge. Now, there's a really interesting participant in the study called Georgios. That's not his real name. And he recounts this example in his personal life of where he had a close friend who'd actually relayed a conspiracy theory about having this friend told him about how they'd supposedly, met somebody who'd gone to the hospital to get vaccinated. And when they were asked to come forward for vaccination, they read out their name and they said, well, I haven't given you my name, so how do you know my name? And the conspiracy narrative was that the person had been microchipped already because of the completely unfounded false conspiracy theory about COVID injections providing microchips into the body, which of course is absolutely false. but it's a widely circulated and surprisingly widely believed conspiracy theory that recurred quite commonly in our interviews, not because people believed it, but because they described that they'd seen it a lot on their social media since the pandemic began. So what George just decided to do was to challenge this person overtly and say, and in the report we talk about this. And he said, you're crazy. And the problem is of course, that the friend then said, well, that's your view. This is my view, and left the chat. And this was actually just a one-to-one chat. So it was a very small group. And what happened then is that, as this participant described to us, is that vaccines were off limits. There was no talk of COVID vaccines in their interactions from then on. And these were close friends. They'd known each other for a long time, and they valued the friendship more than falling out over vaccines. But the problem in this case is that he challenged it in a very overt, not aggressive way, but certainly very overt. He described it. He said, "Oh, you're crazy." That was the phrase he used. And the downside of this is that it backfired, because they can continue to converse about all kinds of things on WhatsApp, but they don't talk about vaccines anymore. So the problem then is that, if you're not careful, the way that you challenge it can backfire and can lead to the subject being put off limits. So this raises again the importance of this dialogical orientation that we talk a little bit about in the report, which has its roots in all kinds of theories to do with deliberation and rational reasoning, argument. There's quite a big literature that we don't talk about in this report about the nature of how to listen, hear the other side, engage with them, and arrive at some kind of reasoned, if not consensus, then at least some sort of modus vivendi where you can kind of bump along together and hope that you can maybe raise the issue down the line in a way that then convinces those who are skeptical of vaccines to take them more seriously and get vaccinated.
Yeah, it's interesting, these backfire effects, and kind of how to navigate these one-to-one interactions, but also scaling up and down between different groups. And as you said, this kind of hybrid interpersonal public dimension. There's lots going on, and I think we can all kind of identify with, because it's this global pandemic that we're all familiar with, but also we all kind of know some of these conspiracy theories. We all may know someone close or maybe not so close that has spread one of these rumors, even if they don't truly believe it, just talking about it. So it's interesting to kind of see it packaged in an academic way, but also with these interesting personal anecdotes. So definitely, I encourage our listeners to check out the report. But Professor Chadwick, thanks so much for taking the time out and sharing it with us.
Thanks so much.
I've just been speaking with Professor Andrew Chadwick, Professor of Political Communication at Loughborough University. Check the episode description for a link to the report we've been discussing. And that's a wrap for this episode of the Social Media and Politics podcast. Thank you so much for tuning in. Next episode, I'll be speaking with Professor Lance Bennett from the University of Washington about the democratic disruption of public spheres. But until then, I'm your host, Michael Becerra, signing off from Melba. See you next time.